We have developed a score, and it is not a score like the others to predict risk. It is rather a patient risk profile. And for patients who get a lot of points on that individual personalised patient risk profile, we recommend in those cases that they go ahead and have a CT coronary calcium score to determine their risk. Now certainly age and gender are important in that, and we give a particular weighting to that, and also uniquely we give a weighting to family history. Now I don't think anybody, you don't need to be an advanced expert cardiologist to realise that if somebody, let's say at the age of 40, has 3 brothers who all died at 41 of a heart attack, that their risk is increased. This is kind of obvious to blind Freddy, and yet, believe it or not, family history is neither recognised nor given a weighting in traditional risk factors, risk scores. So our view is to give a weighting for family history, which we do, and take all of those other both traditional and non-traditional risk factors into consideration to give a score which is an individual risk profile score. Based on that, there will be a recommendation to have a calcium score, and the result of this in many cases actually is quite reassuring. Reassuring means a 0 score. 0 means you've got no calcified plaque. No calcified plaque is kind of a warranty against a heart attack. Your chances of having a heart attack with a calcium score of 0 is in fact 0, nearly 0.0 for 5 years. So the concept is, like mammograms, we would repeat an individual's calcium score every perhaps 4 or 5 years, maybe sooner in high-risk patients, to see how they are going. And in the meantime, we would be managing their risk factors as well as we can. The Heart Initiative puts great emphasis on a holistic approach to prevention. That means that we use drugs if we have to, certainly to lower cholesterol or blood pressure, or to thin the blood, perhaps with aspirin where appropriate. But we are very strong in emphasising a holistic approach to prevention. This means a low saturated fat healthy diet. It means lowering blood pressure through natural methods. It means exercising, reducing stress, being happy in life, having good relationships, sleeping well, and in general having a balance in life. All of these things are very important in terms of reducing the risk of heart disease.